Awesome. Okay. Yeah. All right. Hey, Pascal, how's it going?
Doing good.
Awesome. Awesome. Yeah, myself as well. And like, as you can see from both my frozen shoulders,
It is doing pretty good. Yeah.
yeah, yeah, still sticking. I actually still do a lot of the stretches you give me almost every time I go to the gym.
You've come a long way.
Yeah, 100%. And honestly, compared to all the experiences I had before I was seeing you, it was everyone I saw,
It's just
every
something that.
professional. Yeah, it was completely different because you actually attacked the problem versus everyone else who was just kind of like, let's casually touch him here, just press here, don't stress anything out, don't push anything, just, gentle all the way around, which actually led to nothing improving. And then when I came to see
Yep.
you, completely different and I'm no longer,
Everything's moving now.
exactly, exactly. So this is going to be short. There's 13 questions for the moment, but so
Perfect.
let's get right into it. So can you explain the typical recovery time for frozen shoulder and what factors influence the duration generally?
It really depends. It could take like weeks and months, but for a lot of people, it can take years. But that depends on like how you manage it. Like if you don't touch it at all, like could take a year, right? But
Hmm.
usually, if you tackle it right away, it's mostly like weeks or months. Like it's hard to determine because I've seen people like after 8 weeks it's like magic. I've seen people it took like 12 weeks, 16 weeks to go back to 100%. But that really depends on like tackling the issue right away, get the right diagnosis, and then uh doing the rehab.
Okay, okay. And so given your experience with it, because I know like like when we spoke a lot during our sessions and stuff like that,
That's
what are
right.
some of the most what are the most common mistakes you see patients make during the recovery from frozen shoulder?
Well, number one is like not seeing a physiotherapist, because if you're not seeing someone that will tell you, look, this is what you have, this is what you got to do, stick to the plan, do it, you'll be fine. If you don't do what it takes to get the full recovery, what you're gonna get is like either not improvement or not having the shoulder going back to what it was, right?
Yeah.
Because it requires a lot of stretches. It requires and the strengthening at the same time. Because one thing you don't want is mobility without strength. That's another problem. That's like something Um, you're gonna get your mobility back, but then now you don't have a frozen shoulder anymore, but you're gonna have a tendonitis or something like that because you're not in control of your shoulder joint.
Oh wow. Jeez.
Yeah.
Um,
So like that's literally like the only mistake you can make. It's like not treating it or not receiving the proper exercises throughout the rehabs, right? Because
yeah.
keep going. You're probably gonna like give me the question later.
Yeah.
Huh.
Oh, potentially. But like, so, one of the things I was curious about, because I saw you after I saw my chiropractor, right?
Yep.
And so physiotherapy in general, like I know for chiropractic care, how does physiotherapy complement chiropractic? Like I know I eventually just saw you overall after I was seeing Dr. Wexel, but how could you say your treatment of my shoulders, for example, or in general for frozen shoulder, how did that not only complement but enhance chiropractic care?
It really depends on what you actually need, because it also depends on the professional. Because let's say like a lot of chiro will have a practice where they do like a lot of manipulations and adjustments, but they like, let's say like they're not going to give you exercises, they don't do the rehab plans, right? So it
Mhm.
really depends on who you're seeing, because I'm sure a lot of chiros can do the full rehab because they know how to do it, but like if they don't, like you just mostly need a physiotherapist for that type of problem. So
Okay.
like I would have to say like that for most frozen shoulders, like you're gonna need uh physiotherapy more than anything else. But for
Hmm.
other types of problem, like Cairo could be pretty good. Let's say you have lower back pain, you need like some mobility in the joints, like
Hmm.
physio's gonna do the trick. But you might have to you might have to need some chiro for another problem, right? So it really depends
Okay.
on the problem you have. But I have to say,
Mhm.
like frozen shoulder, like physio's probably gonna do the whole thing.
Yeah. Okay, that makes sense. And so for someone in the frozen phase of frozen shoulder, are there
Yeah.
specific treatments to or exercise you suggest for that specific issue?
Well, like there are generally two phases. You got like the pain phase and the freeze phase. Well,
Hmm.
in both cases, you don't have mobility. It's like in both
Yeah, this
cases
is
you
true.
can't move. It's just for a different reason. So like what you typically want to do, like the best approach to do, like no matter what, is that you need to catch yourself in that initial phase right away, which is the inflammation phase. And
Okay.
like what's evident, like the evidence-based practice for this type of problem is like what you want is a cortisone shot. You
Okay.
need to like put out the fire as soon as possible, because during the phase of inflammation it's like mostly damage control. You're not going to progress by stretching it, because you're just going to make the pain worse, and then you're going to move less because it hurts more, and just it's not going to work as it should. It's just not going to improve. It's probably going to make it worse. So you want to tackle that like pain phase immediately, because
Hmm.
you want to get in that like frozen phase as soon as possible. And then when the
Okay.
pain starts to become more manageable and you can actually feel like the stretch, because you're not just limited by pain anymore, you're limited by an actual capsule that's tight. Well, now you get into the stretches and the strengthening. They have to be done at the same time. It depends on the symptom, because every patient's different, right?
Okay. Yeah.
I've seen people like improving drastically after in a couple weeks. I've seen people, it was like just baby steps, but like slow and steady, right?
Okay.
So that part, it depends, but what doesn't depend is that you want to tackle the inflammation as soon as possible, and then get the stretches and the physio.
Okay, that makes sense. And I know this one you might enjoy because I remember when you started dry needling, it was awesome.
Yeah,
So,
yeah,
so like even for me, like dry needling was an awesome part of my recovery when you added it, you know? And
yeah.
so how do you typically incorporate it into like a treatment plan? Like, is it always necessary? How to what degree is it necessary? Like how do you utilize dry needling for what it works?
Well, like first of all, dry needling is really effective for releasing the muscles and for pain management. But tight muscles do not contract properly, and you
Okay.
always need muscular control. We're not needling the shoulder capsule; it's too deep, right? So we're
Hmm.
just needling the muscles around the shoulder. So when you have a frozen shoulder, there's a lot of pain, and because you don't have a lot of movement, there's a lot of cheating. So you're gonna like use every compensation mechanism in the books, like overusing the shoulder blade, the shrugs. So you're gonna have your upper trap super tight. Your rotator cuff is full of triggers in the back because you can't use external rotation. So there's gonna be a lot of tight muscles and trigger point that can also create pain. That's part of the frozen shoulder problem, is that at some point you're most likely not just gonna have the frozen shoulder pain, you're gonna have trigger point pain, and you're gonna have like muscle pain in the back. So you want to do dry needlings or just regular manual therapy in the muscles that are tight to kind of just do better with the treatment. It's not just stretches. You want to release the muscles as well. You don't need dry needling to do it. It's just super effective.
Okay. Well, because I remember also like one thing that you utilized was a trigger point therapy, right? Um,
Yeah.
so like going into that from the dry needling, what are some of the benefits of trigger point therapy either on its own or in conjunction with dry needling?
They both do the same. It's just that the dry needling is much more effective, because
Okay.
it's more of an intense stimulation to release the muscles. Now I also do now dry needling with electricity, which is awesome. It's just even more effective at releasing the muscles. But most people, like a lot of people, don't need it. And I have a lot of patients that like I talk to them about needles because I think it might be useful for their condition, and they don't like it. They don't want dry needlings. They're afraid of needles. some counter indication, in which case like you don't want to do needling in that area for whatever
Mhm.
reason, and then the rehab still goes very well. It's just that it's really effective at releasing the muscles. So I love to do it, but
Yeah,
it's not 100% necessary. It's just a really nice tool to have in your toolbox as a therapist.
for sure. And I will definitely 100% account for the fact that dry needling works brilliantly well.
Yeah, it
um,
does.
yeah, so now this is more along the lines of the muscle itself, right? So from your experience, how does muscle degradation affect recovery? And can anything be done to address that when someone's going through frozen shoulder?
Well, it's gonna be the same two things. It's gonna be releasing the muscles with manual therapy because tight muscles do not contract properly and they
Mhm.
hurt, and it's gonna be the strengthening. And everybody's strengthening, like everybody's gonna have the same basic exercises, but then after that, depending on what you're doing, you're gonna need those more functional, those more high level exercises. Let's say like you don't go to the gym and you never do pull-ups, so you're never in that suspended position. Well,
Mhm.
I'm probably not going to give you like stability of the shoulder joint and the shoulder blade in that suspended, like in the air position with the grip. But if you do, I'm going to give it to you because you need to feel what it's like to be stable in that position, feeling you are 100% going to lose if you have a frozen shoulder, because you're going to get super stiff, you're going to lose that strength. And that's basically what happens, is that the longer you have the frozen shoulder, the more the muscles are atrophied, right? So the
Yeah.
weaker you become, so the more strengthening you're gonna have to do. So sometimes that affects that problem, is that you need the weaker you are, the more strengthening you need.
Okay. Yeah, that makes sense. Um, the next question is, so based on how frozen, like I was young when I got frozen shoulder, right? Like I just turned 40 this year. So like this was like what, 4 or 5 years ago that we saw each other. I don't remember anymore.
Yep,
But
yep.
so is there a difference between frozen shoulder with someone my age or someone who gets it when they're much, much older? And given that they are older, is the approach the same, or like how does that work?
The approach is literally the same. It's just that your case was in the more how can I say this? It's like you weren't in the majority of the typical people that have a frozen shoulder, because most people that have a frozen shoulder, they're like between like 55 and 65, mostly females because of the hormone change. Like
Yeah.
the frozen shoulder, it's something that is not like, it's called the etiology, which is like the origin of problems and like pathology. And the etiology is not 100% understood, right? But we
Yeah.
know that it often has effects with hormones. So that's why when women get into menopause, like they might have a frozen shoulder. You're also gonna have people that are gonna have frozen shoulder after a trauma, after immobilization, right? But in
Mhm.
in your case, you had like added conditions that kind of facilitate like the frozen shoulder problem. But
Yay,
you,
diabetes.
but yeah, but when I saw you, you were stiff for a long time, so we had a lot
Yeah.
of stuff to work on, right? The
Yeah.
weakness had building up because you're only strong you're strong in the ranges of motion you go into, right? So if you lose
Mhm.
it, you gotta get it back.
Yeah.
But when you're much older, what happens is that you're probably weaker. Like, let's
Yeah.
say like you're a woman, you're like 60, but you go to the gym, you work out, you move, you have a strong upper body, you don't just do walking and biking, like, and you don't just do yoga, right? You do actual strengthening. Your
Mhm.
rehab is probably gonna be much faster.
Okay.
Strength
Wow.
strength is super important. Baseline condition before having a problem is super important for like any problem that you have.
Okay, that's really awesome to know. More people should go to the gym. um,
That's right.
yeah, yeah. Okay, so then is there a way you can let us know, like, especially when going to the gym, right? Because this is something that I find a lot of people have difficulty with, and especially when it comes to frozen shoulder, that I had to learn, especially when I was working with you, was to identify the difference between good pain and bad pain, right? How important is it to
Oh
know that
yeah.
difference for your body when it comes to frozen shoulder recovery?
It is pretty important. The number one feeling I'm going to tell you, there's a little noise getting to the clinic. All right. Um, so there is bunch of differences. The main difference is that you always want to be in that tolerable setting
Mhm.
where you want to be able to manage the amount of pain you have, right?
Okay.
So that's the number one thing. If you cannot manage the amount of pain and it's just too much, 100% it's gonna make it worse, right?
Yeah.
So I'm gonna set this. All right. So
Hmm.
yeah, it's 100% going to be a problem. The number two things is that feeling of stretch. You know,
Okay.
it's easy for me to tell because when I'm gonna do a stretch and I'm gonna try to mobilize your shoulder, I'm gonna be able to feel resistance, right? It's
Yeah.
like you pull on a band. The more you pull on it, the more resistance you feel. But if you tell me to stop and I just didn't feel any resistance, like you're just straight up limited by pain, and that's not something you want. You also want the associated feeling of like feeling a stretch. So that would normally be the things I tell my patients is that you number one, you want the pain to be tolerable. You
Mhm.
also want the feeling of the stretch that comes with it, and you don't want to make it worse. So you have every patient has a different pain tolerance. Every
Mhm.
patient's different. So like everybody has to do at the beginning of the rehab their own limit testing, whereas you don't want to make it worse after. Because if you just push like a maniac in your shoulder and you're like, oh, that's pain, let's go, and you try to push on it really hard, what's probably going to happen is that your shoulder is going to be more sensitive for the next 3 days and you're not going to do anything. And like with the frozen shoulder stuff, you want to do those stretches and you want to move every day because or else it's
Yeah.
just step back after step back.
Yeah. I remember after I got my first frozen shoulder before I saw you, what made me get the second one to go see you was because the first one I got from overtraining, the second one I got from stopping all movement altogether because of the first shoulder. It,
Yep.
I was not happy. um, so
I understand.
so then what would be like the most important piece of advice you would give someone who was newly diagnosed with frozen shoulder to ensure a smooth recovery?
Number one, you go see a physiotherapist. That's going to be the number one thing because if you see a physiotherapist, he's going to be able to tell you that's a frozen shoulder or that's not it, right?
Mhm.
Because let's say you have bursitis, tendonitis, most of these problems, you can have a ton of pain, but you're not going to require an injection right away. And you don't want an injection. It's just that for the frozen shoulder, you want it. It's one of those problems that it's actually indicated by the science that you actually want a cortisone shot straight up, or else
Okay.
it's probably gonna take a long time. But
Okay.
go see a physiotherapist. That's literally like the only thing you need to do.
Yeah. You work at Next Gen Physio, right? So
That's right.
yeah. Okay. 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 So then this is a little bit different. This is going from like the mindset perspective, right? So what role does a patient's mindset and consistency play into their recovery? Like as far as having to either motivate themselves or something like that, like how important is that when it comes to treating patients?
Well, it's pretty important, but also that's why I'm here. You know, I'm when you come and see me, like especially for a frozen shoulder, like we're gonna have to see each other like once or twice a week for the first couple weeks, most likely. I'm gonna be your main cheerleader. You know, I'm gonna be your hype man. So like motivation, like it's fine. I'm gonna do like that pep talk every time. But like
Yeah.
what's mainly important is the consistency. Like you need that discipline to do them, even though it hurts. It always has to be tolerable, right, with the pain because you don't want to make it worse, but you still have to do them every day, or else it's going to take a really long time. So I make sure to make myself clear that it's not going to be the most painless rehab. It's one of the most like painful rehab I do because you have to push in those positions. And when I do it, it's much more efficient than when the patients do it themselves. But you still need to do it yourself every day, unless you come to my office every day, which is like not possible because you don't have, most people don't have the infinite budget of like
Yeah.
coming and see me every single day for their rehab, right?
Yeah. But this is also why you kind of construct plans for people to stretch at home on their own kind of.
That's right, because you don't have a
Yeah.
choice. Like you need
Yeah.
to do it every day, or else it's just not going to improve. Like your body responds to what you do every day. So it's
Yeah.
like what I tell every patient for every flexibility problem, your body's going to respond to what you do every day. If you want to do the full side split, you need to do the split 3 minutes every day, not 30 minutes on the Sunday, right?
Yeah. Yeah.
So you're going to need those daily drills in order for your body to adapt and give you more range of motion, or else you're just going to stay stuck in that position.
Yeah. That makes 100% sense. So then, given like we talked about, trigger point therapy for a little bit, we talked about dry needling. Are there any advanced techniques or treatments you use that are particularly effective for frozen shoulder cases, or is it mainly the kind of tried and true things you have to do that work, so to speak?
Oh yeah, it's the basic stuff. Like
Okay.
we don't reinvent the wheel. Like
Mhm.
the things that are gonna be efficient, it's the basic stuff. It's like catching it early, doing the stretches, the consistency with the patients, and then you have a physio that knows what to do, that knows how to respect your limits, and then later on in the rehab when you're much more functional, it's like tackle those things you want to get back at, right? So like
Yeah.
doing some exercises specific to your sports or the activities that you do, right?
Yeah.
So that's gonna be, we don't reinvent the wheel here. There's nothing like every any therapist like can do a rehab of frozen shoulder and like it goes back to 100%. You just need to know what to do.
Okay. Yeah, that's perfect. So then finally, then, do you have any final thoughts when it comes to frozen shoulder or advice for people?
It's most people like will need cortisone shots at the beginning if you have a real frozen shoulder and like you cannot move, like it's like you go nowhere with the shoulder, right? Especially at the beginning, you want that first cortisone shot as soon as possible and you get into the physio session right away. You, depending on how it evolves, you might need a second one and maybe even a third one. I don't see a lot of people getting a third one in my patient. It usually goes pretty quick, especially if you do the exercise.
Yeah.
Go see a physiotherapist, do your drills. Honestly, that's pretty much it. Like
Yeah.
even though the etiology is not completely understood, the rehab is rather simple. It's really not
Yeah.
it's a rehab that I qualify as simple but not easy. Like it's
Yeah.
simple because the plan is pretty clear. You just do this and you'll be fine. It's not easy because you have to do it. It's painful. It's the consistency every day, but it just works.
Yeah, I know that because I know for me, I ended up getting after like when I was seeing you, I only had to get one cortisone shot in each shoulder, and then after that, with your exercises and everything like that, that was all I needed, and it was
Yeah,
perfect after that. So yeah, no, thank you so much for your time, man. Everyone who's watching, this is
pleasure.
Pascal Séguin from Next Gen Physio, amazing physiotherapist, really knows everything about training, about working out, taking care of yourself, and making sure that rehab goes well. No more frozen shoulder. It goes very,
That's
very
right.
well. All right. Thanks so much, Pascal.
Hey, my pleasure. See you on Instagram.
Definitely, definitely. Hopefully, we'll see each other soon.
All
Cheers.
right. Bye bye.